Hi, I'm Ellie Glazer, founder and director of the Soveya Solution, where we're revolutionizing the way the world looks at weight loss. So I throw that term around a lot, the Soveya Solution revolution. But I really mean it. It's not just a cute catchphrase. We are really trying to change the way the world looks at dieting and weight loss and take it away from the perspective and the focus on changing our weight and focus on changing our relationship with food, which certainly is not as much of a short-term fix as opposed to a long-term solution. And that's really where we find that most people are craving the results, as I was, because it's no big deal to lose weight. The greatest credibility that I have with my clients and my audiences that I speak to is that I've maintained that weight loss for 16 years. So what has changed in me is the same thing that can be changed in anybody. And it doesn't require surgery or supplements. And we've said, some controversial ideas and statements and conclusions. If you've been watching this video podcast over the last several months, you've seen it, and we try to educate people and inform them and not just inspire them, but transform the world, transform the way that people really look at and approach the concept of weight gain and obesity. Like, it's not about ketosis, it's not about calculating calories, it's not about counting points, right? Those are the classic approaches that, the mainstream weight loss and diet industry leaders will have you believe is the formula for success. But we know it's not, because the recidivism rate is so high. The rate of failure is so rampant. And another thing that I've mentioned before that is certainly quite controversial on face value is that obesity is not a medical problem. It's a behavior problem, and it's not a weight problem, it's a food problem. So obviously the first question that you'll ask right away is that, Ellie, how can you say it's not a medical problem when overweight and obesity is among the leading causes of heart disease, high blood pressure, high cholesterol, stroke, type 2 diabetes, and several forms of cancer? I mean, not to mention the scores of chronic ailments and conditions. I mean, aren't we literally killing ourselves with our forks and our knives? Of course we are. Absolutely. But the answer is that these deadly risks directly associated with weight gain and obesity are a result of our eating behaviors and lifestyle choices. They are the consequences of our actions. And if we want to take them seriously, an effort to eradicate them, then we have to focus on solving the problem, not salving the sore, not putting salve, S-A-L-V-E, on the sore, but solving the problem. Now, I want to be quite upfront. Please don't misunderstand me. I'm in no way discouraging anyone from avoiding a doctor. It's essential to seek medical help for any kind of illness. And I'm not just saying that as a, quote unquote legal disclaimer. It's true, it's real, It's the responsible and a prudent thing for all of us to do. And some of my best friends and family members are highly competent and caring healthcare professionals. But even a bariatric surgeon will tell you that the long-term efficacy of any invasive weight loss procedure is not as much the surgery, but dependent on the patient changing their eating behaviors and relationship with food. And what I want to share with you tonight is an incredible story that I saw recently from a very brave and honest doctor, a Dr. Jason Fung, a nephrologist who did his medical training at the University of Toronto and at UCLA. So he's a mainstream doctor, and he really focuses on the issue of type 2 diabetes, and he sheds a tremendous light and an insight into the concept that obesity really isn't a medical problem. It's a serious medical consequence of a behavioral problem. And he really also opens the door to tell us why doctors are not equipped to deal with it. So I'm going to quote directly from the story that he wrote. It's online. The link to it is just below this video in our email. So I really encourage you to read the full story for yourself. But I'm just going to quote some snippets of it for you tonight. So he starts out. He says, generally speaking, During the 4 years of medical school, the total amount of time spent on nutrition is about 10 to 20 hours during the 4 years of medical school. So let's do the math. Now, I never went to medical school, but I looked up, and it's not that hard to find. The average week of a med school student could easily reach 80 hours of clinical work, easily. But let's be just very, very conservative. Let's say it's just 40 hours, which is very, very low. But let's just say it's 40 hours a week of clinical work times 50 weeks a year times 4 years equals 8,000 hours of total clinical time invested in medical school. And what's the typical high-end amount of those 8,000 hours that are devoted to nutrition? Says this doctor, 20 hours, which is 0.2%. Again, just let that sink for a second. 0.2% of their time in med school over the 4 years is dedicated to the issue that is close to overtaking smoking as the #1 cause of preventative death in the United States today. So I'm going to continue quoting from his article. I graduated from medical school, Dr. Fung said, with essentially zero knowledge of nutrition as most people know it. What people really want to know are things like, should I eat more carbs or less carbs? More fat or less fat? Is sugar bad? How do I lose weight? Those important health questions, he says, are apparently not considered the purview of many medical school teachings. He continues, I found that medical school provided less training in real-life nutritional questions than most health clubs or gyms. That's a doctor sharing that admission. And he goes on. Certainly, every medical student knows that obesity plays a dominant role in metabolic diseases like type 2 diabetes and metabolic syndrome. In turn, these metabolic diseases raise the risk of heart disease, stroke, cancer, kidney disease, blindness, amputations, and much more, he says. Doctors understand the importance of weight gain in relation to disease, but not necessarily enough to educate themselves on how to lose weight or what people should or should not eat. Instead, he goes on, a doctor can be trained to think weight gain can lead to metabolic disease and other problems like heart attacks. What drugs or surgery should I give to patients after they have their heart attack? Unbelievable. And he goes on, I quote, obesity and metabolic disease are destroying our nation's health, yet medical schools still do not adequately teach medical students or residents how to actually treat these problems. Doctors often tell patients to lose weight. What they don't often tell patients is how to lose weight. The entire medical school curriculum about weight loss largely comes down to the old advice. Eat less, move more, cut about 500 calories per day, and you'll lose about 1 pound of fat per week. If there's a new drug for, say, lung cancer, doctors immediately want to know, does it work? For weight loss, we learn about this calorie-cutting new method, but nobody seems to ask, does it work? We already know it doesn't, he says. People have tried this weight loss method for the last 50 years, and more often than not, it's not effective over the long term. Most studies on calorie restriction for weight loss fail in one way or another. The success rate is about 1%, he claims, which is universal. Doctors were trained to give weight loss advice that had an expected failure rate of 99%. He says, what boggles the mind is why doctors don't stop and think about why they're giving advice that is expected to fail 99% of the time. And he concludes, you ready? Hope you're sitting down. Should you talk to your doctor about weight loss? He asks. His answer is, would you ask your plumber to remove your wisdom teeth? So again, please, just see the link below to read the whole article for yourself. So with that as an introduction, I want to, ask you to consider joining our upcoming coaching group if you have been struggling with your weight loss. It really is a proven, realistic, and holistic approach to solving the problem of our relationship with food instead of just salving the wounds of weight gain. The Soveya Solution, been doing it for the last 15 years. Thousands of people have benefited from it. And we're here to really change the world. And we are changing the world one person at a time, 1 pound at a time. So I want to share just one sample of the feedback, the unsolicited feedback that we received from participants in the current coaching group that's ongoing right now. And I'll quote, "Yesterday, I was very, very tempted to eat fresh, hot, whole wheat, homemade pizza I made for Rosh Chodesh, but I had written to you a commitment I couldn't break." Because one of the tools that we have in our coaching group is to have accountability commitments. So this participant continues, "I just couldn't have any. I made the commitment. It was staring me in the face, but your written commitment helped me, and I won. Your sessions have been so, so helpful. They really get me thinking, and I see a change in my mindset toward food." And that was from our participants in Melbourne, Australia. So you'll find all the information you need about our upcoming group and how to join just below in this email. If you think that this is a viable option for you, sign up now because space is limited and registration is closing this coming Monday, just a few hours before the live launch of the webinar starts. So I hope you'll join us, and we'll also learn to internalize and digest the most nutritious, delicious idea and meal that there is, that nothing tastes as good as feeling good feels. Thanks for watching and have a great week.